whenever you are thinking of your existing project and how you can really integrate like data and how you can include information. And maybe to start, let's think about what do we consider as data. So data can be anything. It can be a story that somebody told you, uh, you know, so think of it as any information that you may have that you may want to use. So as it just got shared, I'm from Johns Hopkins School of Public Health. That's where I'm currently am. And I studied medicine in Rwanda, and I'm also was born and raised in Rwanda. So, and I just finished my PhD. Interestingly enough, my PhD used the demographic health survey data for Nigeria, looking at gender egalitarian attitudes across Nigeria and perception decision making. I'm founder of Healthy People Rwanda, and I co-founded the International Alliance for Family Planning. I'm very sure that most of you on this call are also youth leaders, and I can definitely relate with how busy you are. So I really appreciate you taking like some time to listen to my presentation. Yeah. So what to expect from this presentation? I want us to really reflect and focus on planning, designing, and evaluating a project. And it can be a program. Again, those differences are pretty fine, but whichever you want to think of it as, think of it that you are planning, you are designing, and you are evaluating. So the more you plan and analyze before, the bigger the chance of a successful project without too many obstacles that you have. So I'm going to share with you a tool, which is called Logical Framework Approach. And many of you may be familiar with it. Some of you may be not, but treat this as a conversation that just gives you a tool to use whenever you think of a project. And there'll be so many other literature around that you can look at, but I hope this will be just like a food for thought that you can use to go ahead and really master this tool, because I found it very useful in my own life and in the project work that I've been doing in public health. So what's LFA? So LFA is the acronym for Logical Framework Approach. It's a process that comprises a number of steps and tools to plan and manage projects. So a project can be a one-page project matrix format in overview that captures everything if you look at it using LFA framework. So the core features of this framework is the project development and project management tool, and it kind of utilizes a program-oriented approach to project development, and it's based on a causal thinking of the intervention. So you are really looking at what's the cause of the problem I'm trying to address, and how can I address this problem? So how is it relevant to SRHR / family planning programming for young people? So first of all, you have to look at the relevance, feasibility, and sustainability of any project that you are working with this population, because that you are young people are in the formative years. So whenever we are thinking about the work we do for them, we have to reflect: is it relevant? Is it feasible? Is it sustainable? So those key three words are very important. And you also want to have to overcome major errors in planning structure, because you don't want to overlook some specific and key elements that otherwise would have made your project successful. So all key stakeholders' participation and efficiency, correct situation analysis, correct solutions, and activities for your work. This is what LFA makes sure that you achieve. So it also allows you to capture a shared understanding of the situation and different needs and interests. So this is basically how we look at transparency. So you are looking at bringing together the stakeholders, thinking of the stakeholders involved, asking people and trying to really get deep dive into that problem and understanding what's the problem there. And that's really where data comes in. So you have to understand what's problem am I facing, how big, what's the magnitude of the problem, what really confirms that it's a problem. So there may be stories, there may be reports, there may be news article, anything that gives you that information. That's what we call data. Then it also helps you to make sure that people feel that they own the program and that they are responsible of the program, because you've related to what is really resonating with the current status or current state in the society. So key steps of logical framework approach, and here I'll pause if you want to write this down. If you want to take a screenshot, do it, because we'll be going back and forth on this. So you have 9 steps of logical framework approach. So you the first step is to analyze the project context, as I just alluded to. Second, you need to analyze the stakeholders. Then the third is problem analysis or situation analysis. Then fourth is activity analysis, objective analysis. Then the fifth is plan of activities or activity analysis. Then sixth is plan for resources or inputs. Seventh is indicators and measurements. And eighth is risk analysis. And 9 is analysis of assumptions. So as you can see, if you've thought of a problem through these 9 steps, you've completed a good understanding of that problem. There's nothing left. And then you can decide what to take on, and maybe what to put in the next phase, what to put in the third phase, and so on and so forth. So the first step, so the project context. So for the project context, you have to always look at the problem as part of a larger context in larger situation. So if you are looking at poor access to sexual and reproductive health and rights services or information to young people, it's not an isolated problem. It's part of a larger context in Nigeria, and it may be localized based on which region you are in. And so you have to always look at that in relation to the local context, of course. So you have to reflect on which environment will the project be situated in, which factors are of importance for achieving the objective, and you have to analyze the context. And there's a tool that has been used several times, and you may be already aware of that, the SWOT analysis. It just allows you to understand that context. So there is always this mistake where people feel that if you've done a SWOT analysis, you've done it all. No, it's just the beginning. So I hope that if you've been in those situations, that you thought the same, we are in the same realm of thinking. So for SWOT analysis, so SWOT stands for strength, is W is weakness, opportunities, O, and T is the threats. So now let's look at you are thinking of the SRHR problem. So let's say the strength can be established partnership with local health organization, government and community support, skilled healthcare providers, and evidence-based approaches and cultural-sensitive education materials. So you have that, so that's strength. Then the weakness, you probably have no funding, there are probably taboos and stigma that may affect your work. There's inadequate facilities and maybe access in rural places. Sometimes there may be limited data so that makes you feel like, okay, you really don't know how you are, you don't know how to quantify the problem you're trying to address. So then the opportunities maybe there's an opportunity to use mobile digital platforms. There's an opportunity to of the increasing youth population, which provide a wider impact that may be of interest for donors. Then there's potential for collaboration. Then for threats, you are thinking of political and economic instability and security. Sometimes if you are in an area where there's a insecurity, then it's really difficult for you. It may be a big threat for your work pretty much. So there may be resistance from conservative groups, depending on your region or your area. Then there may be high rates of misinformation that you may have to debunk, which may be like very difficult. So this is just to give you an example of what a SWOT analysis may include, because this is what will make you understand, okay, these are the strengths that I have, so you can capitalize on them. Weaknesses that you may have to reduce, then the opportunities, of course, and threats, pretty much, that you have to be aware of. So stakeholder analysis, that's a second step. So the stakeholder analysis, it basically allows you to map those people who are influenced by and exert any influence on the project entity. So then you have to map those stakeholders and their respective roles or potential roles in your work. Then who would be influenced either positively or negatively by the project? Then which stakeholders should be involved in planning or implementing the project? And there's a general guideline. When you think of stakeholders, you have to think of 4 groups. So there's beneficiaries, there's implementers, there are financing agents, and there are decision makers. Most of the time, when we think of stakeholders, we think of donors, but they are just one of 4 main groups. So we have to always think of beneficiaries, implementers, and decision makers. And here I give you a simple template that you can use, and I can share this PowerPoint later so you can use it as a reference if you were already wondering. So you can always use this like a little table to kind of really understand the stakeholders that you have. So there's for government, for example, you are looking at, if you are designing an SRHR program, you are thinking of government, health ministry, you are thinking of local NGOs. Then you have to map what's the possible contribution, then what may be the possible effect. And you have to always remember, make sure you put a field of how relevant is that stakeholder, because you will always have so many stakeholders, but you have to know how to prioritize them. And you always have to think of who are the other local NGOs doing the same work, exactly what you are doing, that we can collaborate. And who are the international donors that I can probably use as a resource, and that may be partners. Then community leaders who can facilitate your work, youth advocates, health providers, also private sector entity, because we always don't have to think of resources from outside, we also have to think of resources from the inside. So then for problem analysis, I would say we tend to jump on this step as the first step because we are already thinking of the problem. But the importance of thinking of this as a third piece is that you've already thought of your stakeholders, you've thought of the context. Now, there you are you already had an idea of what you are trying to tackle, but now it's really time to go deep and look at what's the roots of the evil, what's the main problem to be solved, who owns the problem, who is affected by the problem. Basically, you have to try to identify one main problem, because that will give you focus and that will allow you to make your work more effective. And that's really where data comes in, because you may have 4 major problems, but one is a bigger problem that you may want to address before you go on the second problem. So the data will come in there, the stories will come in there, any information that you have access to. So you have to find the causes of and the effect of the focal problem. The cause of the problem shall be tackled through activities within the framework of the project in order to solve the problem in a sustainable way. So, and this is how to think about it. Sorry. So you always have to draw a problem tree that will basically result into an objective tree. And you will always hear people telling you what's your objectives. But whenever you think of your objectives, go back and look at your problems first. So let's say if you are looking at the focal problem and we've been able to identify it, you have to go back and look what's causing this problem. So that's what you put here. Then you look at the effects. What is it? What's the results? What's the effect of this problem? So that's a problem tree. So you have causes that lead to the focal problem and that result into certain impact or certain numbers that you are seeing in the field. So then if you want to develop the objectives based on the problem tree, it's very easy. So you have to say, okay, my focus problem will be my purpose. Basically, that's my main objective of what I want to achieve. In the causes, if I'm able to achieve my purpose, these are the results that I will have. I will be able to address those causes, and that's what the tangible results that the people will see or the beneficiaries. And then I will contribute to an overall goal. Let's say if the effect that you are seeing in your community is that you have so many young people dying of maybe unsafe abortions, for example, or maybe so many young girls dropping out of school because they had unwanted pregnancies, you are not going to solve it with one project. So many projects will contribute to this goal of reducing the number of girls dropping out of school. So that's where you realize that it's just not a simple objective to reduce the number of girls dropping out of school, because it's happening in many places, maybe with the same causes, but for the whole country to achieve that goal, there'll be so many projects that will go into that. And that's why it's called a goal. So a goal, many people will refer to a goal as an objective, and that's where it becomes confusing. So a goal is larger, and it can be contributed, it can be achieved through contributions from multiple objectives. So I hope you get that distinction clear. At least if you don't get anything from this presentation, you should be able to differentiate what's the main objective and what's the main goal. So the goal can be for a country. So the country can say, okay, we want to reduce the number of girls dropping out of school from, let's say, a certain percentage to a certain percentage. That's a goal. And your purpose as an organization is to do what you can do locally, for example, regionally, or even nationally, but it's gotta be specific. Maybe you are trying to target like young girls age X to Y who have specific characteristics, because the reason of being focused, those are people who may have a common cause that you are able to address with one project. So that's the results that you get. So I hope you get that distinction, and I'm happy to repeat if you didn't get it, but you can come back later if there are questions about this. So I have an example here. Let's say your main problem is access to sexual and reproductive health and rights counseling. So that's the main problem that you see that people are telling you. Young girls are saying, I don't have access. I can't find a place for counseling. So then one of the causes may be that the providers do not have or have not been trained to counsel young people. So they don't know how to do it. And what's the consequence? There will be likely unwanted pregnancies. So that's your problem tree. And now if you look at your work, your project, your potential project, your results will be you have trained providers who are equipped with the skills to counsel young people. And what's the main objective? Improving access to SRHR counseling. And again, then you can work on this objective to make it smart. And we talk about it in a little bit. Then the major goal you are contributing to is to prevent unwanted pregnancies. So this one is broader and can be national. It can be like something that a government is trying to improve. Of course, improving access may be also something that a government may be focusing on, but as you can tell, it's a transition to the overall achievement, which is unwanted pregnancies, preventing unwanted pregnancies. So now the objectives, the objective analysis, so you have to think of 3 levels. So you have the overall objective, which is like the goal, often the government, and that's the one that we just saw, preventing unwanted pregnancies. Then the project purpose, which is the main objective, and it's the objective that are for the intervention or project should be able to achieve. So the positive solution, the focal problem, the solved focal problem will achieve. So the reason why the project is implemented. So this also is different in time frame. Usually the goal will be much longer because it takes time to achieve like a large goal. Then the main purpose will be short term rather or medium term, 0 to 3 years. And the as you can think, if you are able to train the providers, that's the first step. So it's short term. Then they will counsel people. That's the midterm. Then you will achieve what? You reduce or prevent unwanted pregnancies. That's going to be the long term, pretty much. So that's just how now you are going to describe your objectives from the problem analysis tree. So when you are thinking of the purpose or the main objective, you have to make it specific, measurable, accurate, realistic, and time bound. And that's what they say SMART. So S-M-A-R-T, so SMART. So for example, going back to our example, let's say our main objective is by the end of 2025, increase the percentage of sexually active young people aged 15 to 24 in targeted regions of Nigeria who consistently use contraceptives from 30% to 50% through comprehensive education, community engagement, and improved access to SRHR services. As you can see, this is a very clear objective. And this is how you can break it through for our SMART criteria. So for specific, we are thinking of targeting contraceptive use among sexually active youth aged 15 to 24 in specific regions. Measurable, aim to increase the contraceptive from 30 to 50%. Achievable by using targeted education, community engagement, improved services access. And this increase is feasible within the specific period. So relevant, aligned with the program's overall goal of improving SRHR outcomes for young people, and time bound, set to be achieved by the end of 2025. So this, I would say, if you have some objectives to revisit, you can copy, have this as reference, and make sure that you are working your objectives to make sure they are smart. So now let's think of the activity. So when you are thinking of the activities, you have to go back to that problem analysis, to that problem tree and objective tree, and see what activities to tackle the causes of the problem. So in our example, we wanted to improve the training, the skills of providers. So now what activities can we do to do that? What will be done under the project to deliver the services results required by the beneficiaries, usually expressed as an action. So it means to achieve the objective, not the objectives themselves. So example, so train health staff about SRHR counseling for young people. So usually when you will see this framed as an objective, but it's technically a means to achieve the objective, because training, yes, you are training, but for what reason? What's the end goal? What's the end results of that? So that's your objective. So then you have inputs. So what do you need to basically do that? So you need experts, personnel, local, foreign, counterparts, project group, partners, collaborators, peers, everyone. Financing, maybe grants, funds, cost. Then you have to think of sustainability. So where will the future long-term financing come from? Equipment, then premises. So like, where do I do this work? So all of that, those are the resources or the inputs that you need for your project. So now indicators to measure your achievements. So always think of a baseline study which might be needed to be able to measure the final result. So always think of how much do I know when I start this work. So the process of setting up indicators shows if the objectives are valid or if they need to be nurtured in some way. So indicators should be able to answer the following questions. For whom I want to do this work? For what reason? When do I want to do this? What do I want to do? Where do I want to do it? What quality do I want to deliver and how much? So you should always think of having the indicators that reflect these 6 key questions, because any donor, any partner, even for your own organization, you will be able to assess yourself. So for example, for this training, I'm sure Damilola will be like, okay, how many people did we have on the call? How many questions did we have? What training topic? We did it on Zoom. Was it a good quality or not? It's up to you to determine. And then how much? We did one, but also it was mentioned that this is one of a series. So you always have to think of those aspects for your own evaluation. So for you to be able to really map out your project, so you will always see what's called a project matrix or a project logic, interventional logic. People call it so many, result management framework. People call it so many names, but all of it is exactly the same thing. You have inputs that feed into activities that reach to a certain output, then those outputs contribute to immediate objectives, and those also contribute to development objectives. So this is your map for your work. And I will say something about the output. The output are those elements that you can, tangible elements that you can always describe in numbers, that you can always say, okay, we train 30 people. So trained 30 people, that's an output. We delivered 1,000 condoms. That's an output. For what objective? The immediate objective is that young people we are going to promote or improve the protected sexual intercourse, for example, to promote healthy sexual behaviors. So that's going to be the immediate. But what's the development objective? What's the goal? That's basically you're trying to maybe promote, prevent the unwanted pregnancies. Maybe you want to prevent HIV. Maybe you want to prevent other STIs, pretty much. Or maybe you want to make sure that girls stay in school, if that's your strategy, then that's going to be the goal. But as you can tell, that's the overall like general goal that you share with the government pretty much. So that was a more simplistic way to look at it. And here is how, in a more detailed way, now you have all of your objectives, and you want to develop a detailed, massive map of your work in your project. So it's always advised to start with looking at your overall objective that you are contributing to. So basically your objective tree, you move it here, as you can see. So you have the activities that feed into the results that will feed into the project purpose, then the project purpose that will feed into the overall objective. So for you have specific indicators for the activities. So let's say if you want to train providers, maybe you are targeting 30 people, maybe 30 doctors, maybe 20 nurses, maybe 60 community health workers. So all of those are the indicators that you are able to measure. Then, so the results here, you are being able to basically have trained providers. So the trained providers, so basically that's an achievement, because it's like you are describing what will you be to achieve. So that the way you measure that, that's going to be your indicator. Then you are able to basically, because your main problem that you were trying to target was that young people don't have access to counseling, SRHR counseling. So your indicator now is going to be the number of young people who are counseled by the trained people. So let's say your goal is to achieve 200. So that's going to be your indicator, 200 young people who are counseled around sexual reproductive, healthy sexual practices or behaviors. Then the indicator for your overall goal of all of those people, how many now do you think will not be pregnant because of what you've done? So this is where it gets tricky. That you cannot predict, but you can ask your people after the end of the program to gauge whether what you trained them actually protected them. So let's say after training, if you realize that more than 30%, sorry, at the beginning, at the baseline, that's why you did it, 30% of young people were having unprotected sex. Now, at the end of your program, 50% are, that would be the reverse. Maybe 10%, only 10% are having unprotected sex. So it means you have 20% change. And then of those 20%, you can then say who could have been pregnant if they had not been trained or counseled, sorry. So that 20%, that's where your achievement is, because you were able to contribute to that reduction with your program. Of course, there may be other factors, but your work is also part of the contributors. Of course, you cannot say everyone did it because of what you did, but you can argue that you were part of that reduction. So then you have the sources of sources of information. Then you make some assumptions. So the assumption here you are making is that maybe what you've done, you are assuming what you've done contributed to that reduction. You are assuming that the people who reported that they did not have, and they had protected sexual intercourse, did it as a result of the counseling that they received as part of your program. So those are the assumptions you have to always list so that people know that you are overselling your work and that they know that you are being transparent and that you are being reflective of what may be the limitations of your assessment. So second to last, we have the risk analysis, the analysis of factors which may influence the implementation of the project and hence the achievements of the project objective. So there may be internal and external risk, alternative strategies which may be needed, and that's the key. And so once you know the risk, then you know how to avoid them. So those are the alternative strategies. Then there'll be like a risk management strategy that you have to basically come up. So I put here an example. It's too detailed. You can look at it a little bit. I know we have 5 minutes to go. But I want to highlight that you have basically 6 columns in this risk analysis. So you have to list your list. Maybe all members are full-time students in your organizations. Then the consequences is that people don't trust students because maybe they are there, they are transitory, or maybe they don't have time. So you have to try to come up with an effect. What's the effect of this risk? Is it so always from 1 to 3, 3 being the riskiest and 1 being the minor, and then the probability. So you have to assess how probable or how likely is that risk to happen. So let's say because students, we get busy, you have exams, so it's likely that would happen. So then you take the effect, multiply the probability, then you know what your pretty much overall likelihood is. So once you've done that, it gives you an idea of what risks to watch out for and what you consider as minor risks and what you consider as major risks for your work. So the analysis of assumption. So you basically are trying to put your project in the perspective of the society, and you are trying to describe the situations and conditions which are necessary for project success, but which are largely beyond the control of the project management. So assumptions on each level of the objective is important. Example, delivery in time of equipment, at least 5. So for example, when you are trying to plan and say, okay, we are going to train 30 people, you are assuming those people will be there to be trained. What if they are not there? So those are assumptions that you always have to make sure that you list. So why different steps in LFA? It's very important, as I said, it's very relevant. So step 1 and 4, you realize that these are very important for the relevance of your work. Like for feasibility, you always have to look at step 5 and 7, and then step 8 for 8 and 9. So you need to always analyze your analysis and assumptions because that's what will play a key importance in your sustainability framework. So in summary, this is a very relevant, feasible, and sustainable tool to help your projects to succeed. So always focus on participation in ownership, and LFA will help you with that. It's a joint approach to project design and development, and make the problem analysis with accuracy, time to correctly analyze cause and effects, and it helps you to connect problems and objectives, and add analysis such as cost effectiveness and gender study on environment aspect to make a clear division of responsibility. So here you can put in other complex analysis to your problem assessment and objective tree if you want, but it just gives you the framework to think through those elements. So please always think of the different LFA steps in all phases of your project. So thank you so much, and I welcome comments, questions, and appreciate your attention. And I hope it wasn't too complicated. I've tried to simplify. This is like large books that people have written on this concept, but I hope it was something that you can digest. Thank you so much.
Okay, thank you so much, sir, for that. That was a very wonderful presentation. So we're going to be taking questions and answers now. So if you have questions, kindly put up your hand so that we can take your questions. If you have any question, kindly put up your hand so that we can take your question. So while we are waiting for people's questions, I'm just going to summarize some of the key points because I was noting so many things as you were talking. I'm just going to summarize some of the key points that I took note of, starting with the logical framework approach. It is a process for planning and managing projects, and it involves several steps and tools. We have 9 steps that you shared with us. We're familiar with some of them. Thank you so much for mentioning them again. Analyzing the project context and doing a SWOT analysis, which is very, very important. Thank you so much for mentioning that. Stakeholders analysis to identify key contributors and their roles. Yes, yes. Also, another key step that I took note of is the problem analysis. This is to identify the core issues, its causes and effects. And then the objective analysis is to define the overall projects and the output level goals. And then defining the specific activity, input or resources and indicator. Then the last one, which is on risk analysis and identifying the key assumptions. Yes, thank you so much for that. I'm still waiting to get her questions, if we have any question.
Okay, thank you very much, Dr. Chris, and very wonderful presentation. I think this was useful. One key question that I would like to ask is the fact that, for example, a small organization, community-based organization, or a very large project, are there some modification that should be done to this framework before it should be used, or it can just be used no matter what the size of the project, or what are some of the maybe contextual realities from your own experience? I know working in sub-Saharan Africa and then working in the US. Are there modification that you have seen to this framework, for example?
So that's very interesting, Isaiah, that you asked. One thing that I've noticed is that personally in my organization in Rwanda, Healthy People Rwanda, which is definitely a smaller organization, we've used LFA a lot, and it's been very, very helpful in how strategic our work has been. And because for every single project, starting from a budget of $500, we always develop a problem tree. We always develop an objective tree, and it goes down to basically all of those 9 steps. It may seem daunting, but once you've done it multiple times, it will only take you like 3 hours for your team to be done with any project that you are thinking about. So one thing that I've realized, because in our small organizations, most of the time we form the strategy as we move forward. So I think we once actually did an LFA trying to streamline our work. So let's say you are trying to, operate in the area of sexual and reproductive health, but mainly targeting a specific, maybe key population. So that's a specific different demographic, and they may have different main problems you can think of. So you can imagine a scenario where you have like 3 different problem trees that speak to the work you are doing. So those are technically 3 different projects that you can come up with, 3 different programs. So that's at least the application that I've seen. One thing I've seen in larger organizations, many of them don't even take time, honestly, to do the LFA, because they tend to be driven by, who is giving the money, and what's their goal. So, and that, to me, that's my perspective, that many young leaders, leaders like us, you will see that if you ask somebody, why are you doing the work you are doing? You can pinpoint 2 or 3 problems that you think matter and that you want to address. And it's less likely that many people will say, oh, this is a good opportunity for my career. Maybe the career piece can come in later, but the focus is you have one problem that you really want to address. And that's why, for me, when Isaiah reached out, I would like to talk about, that's why I thought of LFA, because that's what I think about. Here, at least in the US and in Europe, if you are like an intern at the UN agency, most of the time you have to buy into whatever is there already. Then you adapt, you can shape your concept around it. But it may not necessarily be what you think is actually the major problem. So that's just like the differences that I see in the adaptations, Isaiah. So all of that to say, to me, like the LFA is definitely applicable for a much smaller organization for any size of the problem. You just need to make sure that you are really like streamlining or deepening the going deep into that specific problem that you want to address, pretty much, with a small or a large problem initiative. Sorry.
Thank you very much. Over to you, Tommy.
Okay, thank you very much. I also have a question.
Mm-hmm.
We talked about, you spoke about sustainability for projects, and I know that some emerging organizations are always depending on funds from donors. So how can LFA approach help ensure sustainability of SRHR projects beyond the initial implementation period? Beyond the yeah. Okay, get it.
That's a good question. I was trying to see if I can bring up like the so that I can give people like a quick reminder of. So basically, when we talk about sustainability, usually we are looking at these last steps. So the risk analysis and the analysis of the assumptions. So, and the reason I brought this back is that, as you saw, when we looked at the risk analysis, you are looking at, funding will probably show up here, and see your probability is going to be 3, because it's going to be the biggest problem. So, that's one thing that's going to affect your work in the long run. So when here I said you have to develop your risk management strategy based off of this risk analysis, is basically saying, map out those bigger risks that you think are going to be the most detrimental to your work. Like maybe you're going to make your work not sustainable if you don't address them. So if it's funding, that means that you always have to be thinking of, where do I get the next batch of funding? So it may be, maybe starting a small team that's like there to always be looking for grants. Maybe it may be being strategic. What I've seen here is that in many organizations, they have these people called business development people, that initially I thought they help companies to strategize, but rather they're out there like really looking for, where's that dollar? Where's the next dollar? So that's very interesting, because whenever I thought of my organization, we always thought of who is the president, who is the vice president, who is the accountant, who is all of those traditional roles, but we didn't really think of the business development aspect. So that's where I personally, when we started realizing that funding will always be our hurdle, that's when we brought in somebody to really focus on business development. And we didn't pay the person, so we just took one of the volunteers, try to kind of have them master the skill. And sometimes you may have to pivot from your original strategy so that you can position yourself to be able to attract funding. That's just I would say sometimes that basically the game of the field. But always, at least what I've seen, we always try to go back to what we think matters most. So even if funding may be in a different field, but how about an integrated approach? We've tried to integrate road safety in sexual and reproductive health rights because we had more funding in road safety, surprisingly. So that's really where I think this framework helps you to map what is going to affect you in the next year. And this is no magic. You always know it. It's just not written somewhere. So the beauty is once you've written it down, then you can divide tasks within your organization. Or you can always use it as a reference, or maybe revisit it quarterly to make sure that you are kind of keeping everything in the eyesight pretty much.
All right, thank you very much for that. Even though my network locked me out. So I'm going to take the next question. I can see your hand, Olumuyiwa Olubukola. You can ask your question, please.
All right, thank you very much. Thank you so much, sir, for the insightful presentation. My question is around the problem analysis. So while you were talking about the problem analysis, you said something about having a focal problem. And this problem is what is going to help you to determine the project's focus. So in writing project proposals or thinking about objectives of the project, usually not one, it's usually like 2, 3, 4, sometimes 5. So how do we now expand this one focal problem to give us 5 objectives? That's my question.
I see. So that I knew that was coming. So you
sorry,
can see
Elisa, sorry, before you go ahead, I just because my question is evolving around this question too. Sorry. So I wanted to also say that is there like a tool to identify the major focal problem that should be solved, or you can just focus on one and make that your key problem that you want your project to achieve? Yeah. Thank you.
That's a good one. So I would say when it comes to, let me start with the second one. So is there a tool? How do you actually identify the main problem, the focal problem? So the idea is that that's where you need the data if you can. So if something is killing like 1,000 people and something is killing 10 people, that's different is very clear, for example. If let's say we know in some places, maybe only 5% of the young people have access to SRHR counseling, and in another place it's 90%, you can tell them there gotta be a problem where we only have 5% compared to where we have 90, although that's really like a dream. I don't think it's like the case anywhere. So in matter of ranking the problem, we always try to be quantitative, but I think there's a new concept about being qualitative with the problem, because we always try to look at numbers, but we forget that maybe something is affecting the people's quality of life in a sense that it really should be a big priority. So it really has to be, it's a judgment call that you have to do, because at the end of the day, it's you who's going to develop that program, who will work to address that problem. And I mean, you've seen people who talk about topics that they are passionate to, and others who are not talking about with not as much passion. So it's very clear. So when you are trying to work on something that you are really passionate about, the difference is very, very clear. So I always say the numbers may be there, but having a qualitative understanding or stories that this really makes this a big problem. To me, that's what drives my choice in a sense. Yeah. And of course, if you have the statistics, it's good, but the problem is we don't always have the statistics. So in a matter of deducting 3 objectives from the major objective. So basically you have this main problem is access to SRHR counseling, right? So now your goal is to improve access to SRHR counseling. So as you can see, this is a major, like this is the main focal problem. So in logical framework approach, usually the practice, you have only one main problem. So main problem and main objective. Then when you are trying to write a proposal, they will tell you, make your objectives SMART. So technically, to train providers and equip them with skills, it may be an objective. So in a proposal writing, when you are expanding, this can be specific objectives. So that's what we call, like, so you have goal, maybe I should add another box, goal, main objective, and specific objectives. So these are your specific objectives that you can list. But this will always be something that can come map even in the title of your project, because that's the main problem you are trying to address.
Okay, thank you very much for that. I believe Bukola and Bamdele, you are satisfied with the response to your question. So there's one hand up. Okay, David Agala, you can ask your question.
Okay, thank you very much, sir, for that insightful presentation. My question is pertaining to risk analysis. So I would like to know, based on your experience, sir, are there best practices or adaptive approach to conducting risk analysis, especially in low research setting where our data might be unavailable or unreliable?
So the risk analysis is actually you deciding on the likelihood and the effect, because it's reflecting on your project or your future project. Let's say Isaiah and the team, they are thinking of, like, training young people. And one of the risks is that the young people will not be interested. So what's the likelihood for that? Maybe it's 1 or maybe it's 2. So, and what's the effect? Because if that's the main goal, that's going to be 3. So basically, the effect times the probability, that's going to be 3. So in that case, they know this is a major risk. So we have to make sure that young people are interested. So what do we do to make sure that they are interested? So that's basically the simple formula to do your risk analysis. And again, when it comes to bigger, complicated problems that you don't have control over, it will be like a judgment call, but it just allows you to make sure that you're detailed enough in your assessment.
Okay, thank you very much.